people get lymphedema for many different reasons. In women and men with breast cancer, it typically comes from a combination of disease in the lymph nodes, surgery on the lymph nodes, or radiation therapy to treat breast cancer. And we were talking about some of the most important aspects of lymphedema. And last year, I got the honor of listening to Kathy Bates, who unfortunately has lymphedema from her breast cancer surgeries and her treatment. And she is now a spokesperson for LEARN, the Lymphatic Education Resource Network. And it was amazing because she really spoke to my heart and spoke to every surgeon at the American Society of Breast Surgeons to get them to understand that, lymphedema prevention starts with education. So all of my patients, before they go to surgery, to have any lymphatic tissue removed, even if it's a sentinel node biopsy, need to go and meet with my lymphedema specialist to understand about the educational process. And the things that we talk about are, how do we prevent lymphedema? First of all, the less disruption we can make to the lymph nodes, the better. So we try to be less invasive with surgery, called a sentinel node biopsy, where years ago we would remove 20 or 30 lymph nodes and have them looked at for disease to see if there was cancer there, knowing full well that about 80% of women or men never had disease in their lymph nodes. Lymph nodes act as a filter for our bodies. And if we remove the filter and get a backup, that fluid has no place to go. So a sentinel node biopsy allows us to remove the lymph nodes with the highest risk of spread. And even with the sentinel node biopsy, we know that there is a risk of lymphedema. The more lymph nodes are removed, if more than 10 lymph nodes are removed and then a patient has radiation, we know that in addition ups the risk of lymphedema. So the importance of education, first of all, is how to prevent it, less invasive surgery. Sometimes we treat with chemotherapy first if we know the lymph nodes are involved so that we can remove less lymph nodes. Other things that can prevent lymphedema, obviously protecting our extremities from infection, making sure that if we do get an infection that we contact a doctor very quickly so you can get on antibiotics, and excess weight, BMI. A BMI over 26 increases the risk of developing lymphedema. So education right up front when someone's diagnosed with cancer, not just about the risk of cancer recurring, but the risk of lymphedema is important as well. And so one of the things that Sherry's going to be talking about at the Power Symposium is how we treat lymphedema. So when someone has lymphedema, we have several ways to treat it. First of all, keeping BMI under 25. We do manual lymphatic drainage, typically done by a physical therapist, occupational therapist, or a certified lymphedema specialist. In addition, I'm very fortunate that we have LET, called Lymphatic Enhancement Technology, which is a device that helps to pull the fluid out of the tissues. And the LET has been really wonderful because you can get lymphedema in the breast, in the extremity, and my therapists do a wonderful job in treating lymphedema, but the most important thing about lymphedema is trying to prevent it. So all of my patients get a test prior to surgery. We use a device called SOZO that actually measures bioimpedance, so we can see small changes in fluid. And if we see changes in the fluid level in the tissue before we can actually physically see it, a lot of times we can prevent the lymphedema from progressing. So if you know someone who's about to undergo breast cancer surgery, make sure that they ask their provider about what they do for lymphedema education, what they do to follow them. Do they do a SOZO? Are they measuring with a tape measure on their extremities? How often are they going to follow them up? And what do they do for patients who do get lymphedema in order to help treat them? Because again, prevention is key in lymphedema, and education is the key to prevention.